In this video, we are going to talk about hand expressing, specifically hand expressing during pregnancy. Even in my early days as a student midwife, this was something I felt very passionate about. If you would like to breastfeed, even if it's just for a short while, hand expressing is one of the best skills that you can learn during pregnancy. I have seen countless families on postnatal wards with newborn babies who want to exclusively breastfeed but are not breastfeeding optimally, or perhaps not at all. If you and your baby are struggling to get a good latch on your breast and your baby take a full feed, usually one of the first suggestions that is made is to hand express your colostrum. And hand expressing isn't only useful if you're having a problem. It's also great to do frequently in the early days and weeks of your baby's life, as this can help increase your longer term milk volumes even months down the line. You can also use hand expressing for managing engorgement, expressing milk if you are separated from your baby. You can express milk to use to rub into your nipple if you have any cracks or sore areas on your breast, or you can express a drop of milk to your nipple to tempt your baby to stimulate their rooting behaviours. There are so many good reasons to learn how to hand express your colostrum antenatally. It is much more challenging for you to be having to learn a new skill when you are likely already tired following labour and potentially feeling stressed or emotional that breastfeeding isn't going as well or as easily as you had hoped. If you have learned how to express antenatally, then if a suggestion is made to you to hand express for your newborn baby, then you will hopefully be more comfortable and confident and effective in doing this. In some cases during your pregnancy, you will simply want to learn the skill of hand expressing your milk, and in others you would want to be storing this milk to provide to your baby after they are born. Colostrum is an incredibly concentrated and powerful substance for your new baby. So when you are hand expressing milk antenatally or in the first few days of your baby's life, you will be collecting only very small amounts. Every drop counts. For most pregnant women, it is appropriate to frequently express your breast milk from 37 weeks of pregnancy. But there are some situations when expressing colostrum antenatally can be particularly beneficial. I will pop these all in the lesson text for you, so there's no need to write these down. So, if you are planning a caesarean birth, if you have diabetes, either pre-existing or gestational, high blood pressure if you're taking beta blockers, a history of breast surgery, breast hyperplasia, polycystic ovaries, a strong family history of allergies, a baby who is known antenatally to have additional feeding needs such as a cleft lip or palate, and babies where special care or separation from the birthing parent is expected. In addition, if you're expecting twins or multiple babies in this pregnancy, then hand expressing colostrum antenatally is advisable. In all these cases, it would be recommended to express regularly and store your expressed colostrum. This list is not exhaustive, so I encourage you to talk to your care provider about your particular circumstances and ask them if storing your colostrum is likely to be beneficial for you or your baby. Even if a recommendation is not made to you to hand express to store for your early days after birth, then expressing in the first few hours after your baby has been born can be really helpful to establish your milk supply for the later weeks. In the first hours and days after your baby is born, plenty of breast stimulation from your baby feeding or from hand expressing will help your body to produce a good supply of mature milk. If your baby is feeding well, then you can still give your baby your expressed milk from this time after they have fed from your breast as a little extra dessert. You can also put it in the fridge to store it for a subsequent feed. There are a few situations when expressing your breast milk antenatally would not be recommended. In the UK, the NHS recommends waiting until 37 weeks of pregnancy before hand expressing regularly. This is because nipple stimulation can stimulate contractions. However, many breastfeeding organisations such as La Leche League suggest hand expressing is appropriate from 32 weeks of pregnancy. I would not suggest that you are regularly hand expressing from 32 weeks of pregnancy, but it is likely to be appropriate for you to try occasionally in order to learn the skill. So when are we not going to be hand expressing colostrum during pregnancy? Again, these are written in the lesson text for you. So if you have a cervical suture, that's a stitch in your cervix to stop it opening during pregnancy. A history of cervical weakness. If you currently have or have had during your pregnancy bleeding from your vagina. Early pregnancy spotting is not unusual and should not prevent you from expressing colostrum in your pregnancy. If you have placenta previa, which is where your placenta completely or partially crosses the opening of your uterus, your womb. If you've been particularly advised not to have sex during this pregnancy. If you have a history of preterm birth or have been told you're at risk of preterm labour, and of course if you have particularly been told by your care provider not to express colostrum antenatally. If any of these instances apply to you, then I would recommend you speak with your midwife or obstetrician, as in some instances it would still be considered appropriate to hand express. So when are we going to hand express? As I said, if you have decided you would like to try expressing colostrum antenatally, then it is appropriate to start regularly at around 37 weeks of pregnancy. If you are looking to simply learn the skill of hand expressing, then you may only want to practice this a few times a week until your baby is born. However, if you are looking to build up colostrum in your freezer, then you would want to aim to express 2 to 3 times each day. You should start gently and slowly, eventually building up to expressing on each breast twice each day. It is helpful for you to view expressing as a pleasurable activity that you're doing for your baby when you can, rather than feeling stressed that you have only been able to express a few times during the week. Stress and the body's response to it is not helpful either for labour or for breastfeeding, so try and stay relaxed about expressing your colostrum. Okay, so how are you going to hand express your colostrum? If you're expressing just to learn the skill, then there is no need for any extra equipment. If, however, you're expressing to store your colostrum for when your baby is born, then you will need some 1 milliliter syringes, like this. Okay? In the UK, you can get these from your midwife, or alternatively they can be purchased from online retailers if you search for colostrum collector syringes. In some cases, these syringes are supplied with little caps on them. These little on the top, so you can remove these little caps. If you have a syringe with a cap, that is fine antenatally for collecting colostrum, and it's good from a storage perspective, but the cap should be removed and discarded as soon as you are going to use the milk to give to your baby. If a syringe with a cap on is placed into your baby's mouth, it can pose a choking hazard to your baby. Unfortunately, there have been a number of incidents in the UK where a syringe with a cap on has been placed inside the baby's mouth. A redesign process is underway for a product that does not pose this hazard. There are also a number of reusable colostrum collector products that are usually larger and softer in design. So this one is a 4 milliliter one. Usually come pre-sterilised. You can squeeze the tube to create a vacuum, or you can remove the lid and drip the milk in or scoop it up. Personally, I don't love these for antenatal use, as they don't tend to have much suction, and you can also have increased problems with wasting colostrum when trying to feed it to your baby. As they are quite large, the milk can collect around the top and also get a bit stuck in there. I would suggest these are more suitable if you are very easily filling a 1 or a 2.5 ml syringe. But if you are struggling with a traditional syringe, then this might be something you want to try. So if we want to collect the colostrum with a syringe, then you will do so as the drops start to form on your nipple. So when you get your syringe, it can often be useful to pull back on the plunger. So open the packet. They come in little packets. Come in little packets like this. So open up and just go backwards and forth just to loosen it a little bit. experiment with the syringe in your hand and how you move the plunger backwards and forwards, ideally using just one hand. There is no right way to do this. It's about you feeling in control. So to hand express, you will want to choose a time when you are feeling relaxed and calm. I often suggest to pregnant parents that in the bath can be a nice time to try hand expressing for the first few times. You may also want to have an item with you that makes you think of your baby, perhaps a blanket or a muslin that you have bought for them. You can try some deep breathing or some visualization to relax first. What we are trying to do here is stimulate the release of oxytocin, the love hormone. So let's begin by washing our hands and then gently massaging and stroking your breast. How you massage your breast is of less importance, but the touch should feel pleasant to you. So you can stroke, you can roll your knuckles over your breast, you can use circular motions. We can stimulate or roll your nipple in your fingers. So whatever feels good for you. You're going to do this for around 5 minutes, and you may start to see colostrum glistening on your nipple or forming drops on your breast before you have done the 5 minutes of massage. If that is the case, then you can start collecting it as soon as you see the colostrum forming. So what you can do is you can cup your breast with your hand in a C shape, and you feel around your breast towards your areola and your nipple. So there will be an area, often around the edge of the areola, or a few centimeters back from the base of your nipple where the tissue changes. It's likely to feel lumpy, sometimes like peas. This is the area where you want to compress to express your colostrum. We are all different, but it is often around 2.5 centimeters back from the base of your nipple. So we're going to compress your breast using your thumb and your index finger. So you're going to bring the tips of your thumb and index finger together. Or you can use a flatter index finger, which is often easier when you're expressing on yourself. We don't want to slide your fingers over your skin. Just bring the fingers together, pressing on that lumpy part that you can feel. The pressure should be firm, but you should not be causing yourself discomfort. Then we're going to release the pressure, but keep your fingers in the same place. Then repeat, compress and release, compress, release, compress, release. We are working to a rhythm. You will hopefully start to see glistening on your nipple, and drops of colostrum may start to appear on your nipple. You have a number of duct openings on the surface of your nipple, not just one. So you will likely see milk forming on a number or from a number of these. If after around a minute of compressing and releasing you are not seeing any colostrum, then try moving your fingers ever so slightly forwards and compressing and releasing, or ever so slightly backwards. This lumpy area under the skin can feel more pronounced in some than others. So if you are struggling to identify it, then you can ask your midwife or care provider to help you with this at your next appointment. So once we have the drops of colostrum forming on your nipples, you can suck the colostrum up or scoop it up. So we can suck it up by pulling back on the plunger, or we can scoop it up, or a bit of a combination of the two. Colostrum is sticky and will not necessarily run into the syringe, but instead it can collect around the top. So you can use the plunger to pull it backwards and forwards to help move the milk down, or you can tap on the syringe to try and help move that milk downwards. If you are expressing amounts greater than around 3/4 milliliter at a time, so if we're coming all the way down to here, then I usually suggest to a family that it's often easier to use more than one syringe when collecting the milk. This allows you to keep that movement in the syringe to help draw the milk into the syringe, rather than trying to squeeze every last drop into the one syringe and then risk it squirting out the top when you're trying to make these fine movements. If you feel confident and comfortable compressing and releasing in this way, it can help you to include a step where you gently press back towards your chest wall. Again, we use our thumb and index finger and we position them on that lumpy area back from the base of the nipple. And first we press back towards the chest wall and then we compress and release. Then again back, compress and release. Press back, compress and release. This can really help increase the volume of colostrum you are able to collect. Please remember, we are using a 1 ml syringe for a reason. We are not expecting to see much colostrum during pregnancy. If you are collecting even 0.1 of a milliliter, this is something to be proud of. After you have been expressing in one area for a number of minutes, you may see the flow of colostrum start to subside. Adjust your fingers a little, much like you are rotating around a clock. And to repeat the same process, press back, compress and release. Press back, compress and release. And we're going to start collecting the drops of colostrum just as before. And when you have rotated your fingers, you may find the colostrum is not instantly available and you may need to compress and release a number of times before the colostrum starts to flow again. Again, when the drops have subsided, then rotate your fingers a little. We are using pressure that is comfortable for you. When you are ready, you can switch to the other breast and compress your colostrum in the same way on your other breast. Again, starting with some gentle massage first. So when you're finished, you can use the wrapper to cover the syringe. You will want to write the date of the expressing, and it can also be worthwhile adding your name and date of birth, as this should be added should you want to take your express milk into the hospital with you. You can also place a sticker on the syringe with this information, but try not to cover too much of the syringe, as you will still want to be able to see the markers on the syringe. And also consider when you're going to be feeding this colostrum to your baby, because we are going to be using the same syringe to give the colostrum to your baby. So we don't want a sticker going sort of into their mouth or be having to be picking bits of label off. So keep the sticker or the label well back. And that's another reason to not completely fill the syringe. On a few occasions, I have spent time with a family carefully picking the neatly sellotaped labels off a syringe where it has been taped far too close to the tip of the syringe. You can then store this milk in the freezer until after the birth. Volume of colostrum that you are able to collect antenatally is not a predictor of milk volumes postnatally. So do not be concerned if you are only able to collect very small amounts. If you are not able to express any colostrum, then you may want to ask your midwife or care provider to guide you when you have your next appointment, or reach out to a local breastfeeding specialist for guidance. Often what is needed is just a very small adjustment in the placement of your fingers. In some cases where I have had a family that has particularly struggled with finger placement for expression, I have used small plasters, small sticky plasters like when you have a blood test. Or we can use a pen mark and we find that lumpy area and we can stick them on the side to help guide. You would of course be rotating your fingers around your breast to stimulate other lobes within your breast, but it can be useful as a starting point if you are struggling. And sometimes having your support partner doing the hand expressing for you can be more effective. It can be much easier to express on someone else than it is on yourself. You need to ensure good communication between the two of you whilst expressing. Again, this should be comfortable pressure for you. So we can keep colostrum for 4 hours at room temperature, assuming temperatures are not too extreme, and in the fridge for up to 8 days or the freezer for up to 6 months. If you are expressing your colostrum antenatally, unless birth is anticipated in the next few days, perhaps with a planned cesarean, then I would recommend that you put your colostrum in the freezer immediately after expressing your milk. If you are planning on having your baby in the hospital and you have expressed colostrum antenatally, it can be worthwhile bringing some of it into the hospital. You can bring it in a small cool bag with a freezer block inside it. Hospital policies differ, but in many cases your midwife should be able to store your colostrum in the fridge for you. The milk would then need to be used within 24 hours of you taking it out of the freezer. So if birth is not expected imminently, then it is often better to leave the frozen colostrum at home and have someone collect it for you when your baby has been born. Colostrum defrosts very quickly, so that is not a concern. And we're storing it in such small quantities, it's really quick to defrost. As I say, I encourage you to give antenatal hand expressing a go, and if you are finding it difficult, then ask your care providers or local practitioner for some support. I will see you in the next video.